Well, good afternoon. My name is Mike Merson. I'm director of the Global Health Institute. It's my great pleasure to welcome the graduates and your parents, families, and friends to our Master of Science in Global Health Commencement Lunch and Ceremony. This is the largest gathering we've had since we started the program. Many of you have come great distances. I think I see we have a 3-week-old and certainly people in their 70s here. So we have a very wide range of populations. It's really wonderful to be here. Certainly, there are a few events in one's lifetime that are as important and memorable as a graduation ceremony. And we hope you all have a wonderful weekend here. I'm going to be brief. You have a program in front of you. I do want to say a few things. One, that I want to recognize the faculty members of the Institute who have joined us today. And I'm going to ask to embarrass you a little bit and to please stand, the faculty. And maybe the students will clap, I don't know. You know, there are really dozens of faculty across Duke that instruct our students, mentor them, and we would not be successful without their leadership and willingness to mentor our students. After all, a university campus is a special place. It harnesses the passion and creativity of young minds and matches them with the experience, skills, and knowledge of professors, in our case, to solve the world's global health challenges. And so my personal thanks to all the faculty, and as you have heard, we finally got an applause for you from our students. So our institute is still a relatively new institute at Duke. It's university-wide. We were one of the first in the country to make a commitment to research and education in global health, and it really was because of the advocacy of our students. I sometimes tell a story that on the 12th day I was here, at Duke, I had come to run the institute, and there was a scathing editorial about me in the university newspaper, 12th day, that I had been here 12 days and had done nothing. So just to give you a sense of the feeling of students at Duke and their advocacy when they want things to be done. I like to think that we are among the top global health programs now in what is a very large and growing field. It's no surprise, I hope, to any of you when you just read the headlines. Think of the headlines in the last year. Ebola, climate change, now the sad earthquake in Nepal, air pollution in China, all areas and events, I might add, to which our faculty are involved. But it's because of them that there's such a great interest in global health. We believe that only through a global interdisciplinary approach of the one we advocate and teach our students and use as the foundation for much of what we do, that we can address the challenging global health issues of our time. Let me close by saying to our graduates, I know I don't need to tell you that you are at the forefront of an amazing and exciting field of study and work, poised to make a meaningful impact. I sure hope that what you've learned here will position you well for what's next to come, whatever that may be. I'm proud at what all of you have accomplished, and I know that our world's future is brighter because you, as our leaders in global health of tomorrow, started here at Duke. And remember the wise adage, follow your passion, as all of you have done, and you will never have to work a day in your life. Congratulations, and wishing you much success. Please stay in touch. Our emails are always working. And the last thing I want to do is turn the program over to Chris Woods, who really runs this program. He's the director of, we call him the Director of Graduate Studies at the Duke Global Health Institute. And I hope the students know, but certainly the faculty know, that Chris has led our master's program since its founding. And I personally and all of the faculty are very grateful to him for his commitment to our students, to the program, and to the Institute. Chris?
Thank you, Dr. Merson. So, welcome, family and friends. We are celebrating 38 official graduates this year. I believe that 32 of you are here today, making this, as Dr. Merson alluded to, our largest ceremony thus far. And so it's a very exciting moment for us. So since our inception, as one of the first global health graduate programs in the country, to the recent selection of our incoming 7th cohort, we have embarked together on an important and fulfilling journey to reduce health disparities around the globe. Our graduates have rigorously prepared for that journey during their time at Duke under the guidance of our superb faculty who were applauded just a moment ago. These faculty members have taught you the content and methods necessary to engage meaningfully in the important clinical, epidemiological, social, behavioral, and policy-oriented research that will help guide us to a safer and healthier world. But you brought the enthusiasm and the energy necessary to carry that out, and it has been my privilege to see the results of that effort come to fruition over the last couple of years. To successfully navigate the Duke Graduate School and our global health program is no simple logistic feat. Although our students are remarkably resourceful, I did want to say a special word of thanks to our tremendous staff, particularly and our full education team I want to acknowledge. So Sarah Martin, you can wave over there. Lisa McKean, where's Lisa? Michael Russell. And I did want to acknowledge Melissa Watt, my Associate Director, who you'll meet in just a moment. Melissa, you can raise your hand. And Mary Story, our Director of Education for the Global Health Institute. So the focal point of our program, which I believe all of our new graduates know, is the research project that is performed in collaboration with a Duke mentor as well as an overseas mentor. And this year's graduates conducted their fieldwork in 19 different countries, and you'll see them all listed out on the boards out there, and I encourage everyone to take a peek at those. But there are a diverse array of topics, ranging from emergent monkeypox in the Democratic Republic of Congo to assessing the mining industry, impact on health in the Amazon basin in Peru, to establishing neurosurgical capacity in Uganda. And I can say with great sincerity how universally impressed I have been with the projects that our graduates have submitted to the graduate school. Their success emanates from the efforts of our mentors, their collaborators on the local level, and the infrastructure that's established for the program by our program staff, but most of all, again, by your passion, the students' passion and commitment and willingness to ask the important questions and to pursue answers. Now, I need to apologize to all of you a little bit, the students, that is. I may have been a bit distracted this year. I have to admit that the unprecedented Ebola outbreak may have led me to focus on some different things, and I may not have been as attentive to you all as I would have liked. Now, last week, my colleague Nathan Thielman, who runs the Global Health Research Fellows Program, and I gave medical grand rounds to discuss Duke's involvement in the Ebola response, both locally and globally. And as an introduction, I recounted a couple of stories related to that Ebola outbreak, which I thought put into stark relief how global health disparities can impact us more directly than we may appreciate. And so I'm going to take this opportunity to recount those stories again for this audience. So in November of last year, in the wake of the Dallas case of unrecognized imported Ebola and the associated spread among the U.S. healthcare workers, a 26-year-old Liberian male called the CDC and said that he had a fever, that he was visiting from Liberia, or he had actually just migrated from Liberia, and that he had recently arrived in the U.S. only 3 days before. He had landed at JFK. He had been screened as per the Ebola protocols. He'd gotten then on a bus, taken the bus down to here in North Carolina, and per his report, he had had no known ill contacts in Liberia. However, he had come from Monrovia, where the epidemic was still raging at that time. The CDC referred him to the State Health Department, who then contacted our hospital leadership, who arranged for his admission per an existing plan. He was safely transported by a specially prepared ambulance to the hospital, and he was escorted to our newly renovated 8th floor, which had been set aside to accommodate patients to rule out for Ebola. There he was taken care of by a specially trained group of clinical personnel. He had no further fever and no additional symptoms. He was ruled out for having Ebola by having 2 tests performed at our state health laboratory, and he was discharged on the 3rd day to complete follow-up with the health department. The estimated cost of the care for this brief hospitalization, $200,000. So, for contrast, let's go back to December 26, 2013. A 2-year-old child, Emil Umana, in the remote village of Miliandu in Guinea, became ill with fever and diarrhea. Now, a young boy with fever and diarrhea is not that unusual for that part of the world. And not unlike what any one of us would do, the child's family took care of him. They cleaned him, handled his vomit, his diarrhea. His death, which came quickly, was tragic. But part of the tragedy is that it's not all that unusual in that area of the world, for where between 1 and 2 children in 10 still die before age 5. But what was unique is his sister Philomena, his mother, his grandmother, all became ill and died within the following week. Even a visiting aunt from Sierra Leone died 2 weeks later, having returned to Sierra Leone. The outbreak went unnoticed and undiagnosed. The grandmother was cared for and died in a nearby urban center called Gekadu. And once in Gekadu, the outbreak spread quickly in a typical fashion in healthcare centers there. It was facilitated by an absence of infection control and some cultural practices regarding handling of the dead. Still, the outbreak remained unrecognized until the Ministry of Health of Guinea reported 35 cases and 28 deaths of a hemorrhagic fever on March 18th, over 6 weeks since Emil's death. Ebola was confirmed the following week. Now, in May, the disease was in the Guinea capital of Conakry, population 2 million. In June, it was in Monrovia, Liberia, and by July in Freetown, the capital of Sierra Leone. And we're all fairly familiar with the story at this point. And to contrast with that $200,000 spent in the 3 days in the US, the annual total per capita health expenditure in Guinea is $67. So I think this should give us some pause as we consider where to invest our time, our energy, our resources. One would think that in addition to our own preparedness in this country and in the developed world, that we would be well served building a more responsive healthcare infrastructure in West Africa to identify and contain disease as it inevitably emerges out of the jungle. So each year, I also like to recognize a colleague who has had an important impact on global health and on our program as well. And I think if we polled the students, Paul Farmer would rank highly among them as a global health hero. Now, given that Dr. Farmer will be speaking at graduation on Sunday, I thought it would be important at least to recognize his tremendous efforts to reduce global health disparities. Paul is perhaps most well known for his co-development of Partners in Health with Jim Kim, and that program's service work in Haiti, Peru, Rwanda, and now West Africa. Paul and Partners in Health have pushed the boundaries of what we should consider an acceptable level of care for those in the greatest need. The Ebola outbreak was no different for Paul. He challenged those who were seen as experts in the provision of care, Médecins Sans Frontières in particular, and he pushed for much more aggressive management of these patients. And the following comes from a New York Times editorial. MSF is not doing enough, said Dr. Farmer, one of the founders of Partners in Health, whose staff members are working on the front lines of Ebola outbreaks. What if the case fatality isn't the virulence of disease, but is the mediocrity of the medical delivery? So in April 2015, now May 2015, where do things stand? Well, after substantial investment in outbreak response, the outbreak is now smoldering. In total, there have been 26,000 cases and 11,000 deaths, but now fewer than 100 in the last 3 weeks and none in Liberia. So the situation is greatly improving. And importantly, and I think this is in reference to Dr. Farmer's comments, the case fatality rate is now approximately 25% as compared to 80% at its beginning. And that's without the introduction of a new novel therapy. It's just better supportive care. So working in global health is incredibly rewarding, but the work is also at times unspeakably difficult. Sometimes the challenges seem so enormous that they are insurmountable. We must remind ourselves that change can happen and is happening. Continued inspiration from partners and colleagues in asking and answering tough questions keeps me engaged. And as director of the master's program, I have the opportunity to meet the next generation of global health leaders. And teaching you and working with you as you channel your intelligence and your energy into positive change is why I continue to work into the future. So you are now part of a large and growing family of DGHI alumni, and we look forward to watching your next steps. So go forth, be a doer, inspire others along the way, and take inspiration from each other's successes.